10 colon cancer symptoms you shouldn't ignore. Colon cancer, also known as colorectal cancer, is one of the most common cancers worldwide. It typically begins as small, noncancerous clumps of cells called polyps, which can gradually develop into cancer. While colon cancer often presents with subtle symptoms in its early stages, it's crucial not to overlook any signs that may indicate a problem. Early detection greatly improves the chances of successful treatment. Here are 10 symptoms of colon cancer that you shouldn't ignore. Let's begin our search. If you experience even a single symptom mentioned below, don't panic. Just reach out to your doctor and they will take care of it. Number 1. Persistent change in bowel habits. Persistent changes in bowel habits, such as sudden onset diarrhea, prolonged constipation, or alterations in stool consistency, are important signs that should not be ignored. These disruptions can indicate underlying health issues, including the possibility of colon cancer. It is crucial to monitor any unexplained differences in the frequency and size of your bowel movements. Additionally, pay attention to any abdominal discomfort or pain that accompanies these changes. If you experience persistent alterations in your bowel habits over a period of weeks without any clear explanation, it is advisable to consult a healthcare professional for further evaluation. Screening tests like colonoscopies can help detect potential issues early on and improve treatment outcomes. Number 2. Blood in the stool. Rectal bleeding or blood in the stool is a common symptom of colon cancer. While it may be caused by other less serious conditions such as hemorrhoids or anal fissures, it should never be ignored, especially if it persists or is accompanied by other symptoms. While it's true that hemorrhoids are a common cause of rectal bleeding, they typically present with other characteristic symptoms, such as anal itching, pain, or a lump near the anus. Anal fissures, which are small tears in the lining of the anus, can also cause bleeding, but often occur after passing hard or large stools and tend to resolve on their own. However, if bleeding persists or is recurrent, it's important to rule out other potential causes, including colorectal cancer. Number 3. Abdominal discomfort. If you are experiencing persistent abdominal discomfort such as cramps, gas, bloating, or pain, it could be a sign of an underlying issue in your colon. These symptoms, although common, should not be ignored, especially if they are new or severe. It is important to consult with a healthcare professional for proper evaluation and diagnosis. Abdominal discomfort can be caused by various conditions, such as irritable bowel syndrome, inflammatory bowel disease, or even gastrointestinal infections. Your healthcare provider will conduct a thorough assessment to determine the cause of your symptoms. They may recommend further tests such as blood work, imaging studies, or a colonoscopy to investigate the issue more thoroughly. Number 4. Unexplained weight loss. Unexplained weight loss is a concerning symptom that can indicate an underlying health issue. It may occur without changes in diet or exercise routines and should not be ignored. In some cases, unexplained weight loss can be a warning sign of serious conditions such as colon cancer. Consulting with a healthcare provider is crucial if you are experiencing unintentional weight loss to identify the root cause. Your doctor can conduct tests and evaluations to determine the reason behind the weight loss. Other possible causes include thyroid problems, diabetes, or gastrointestinal issues, but you never know. It can also be due to colon cancer, so seek out to the medical professional. Number 5. Fatigue. Persistent fatigue or weakness that doesn't improve with rest can serve as a potential indicator of advanced colon cancer. This form of cancer has the capacity to induce alterations in the body that result in feelings of extreme tiredness. Therefore, it is essential not to overlook this symptom, particularly when it coincides with other troubling signs. It is advised to seek professional medical advice promptly if you experience unexplained and ongoing fatigue. Fatigue associated with advanced colon cancer can be overwhelming and debilitating, impacting daily activities and quality of life. The exhaustion may be caused by the body's response to the disease, such as anemia or the body using energy to fight cancer cells. Understanding and addressing the underlying cause of fatigue are crucial components of managing the condition effectively. Remember, feeling exhausted beyond what is considered normal should not be ignored. Your health is important, so always prioritize seeking medical guidance when experiencing symptoms like persistent fatigue. Number 6. Iron deficiency anemia. Colon cancer can lead to slow, chronic bleeding in the gastrointestinal tract, which may not be visible to the naked eye. This ongoing blood loss can gradually deplete the body's iron stores, leading to iron deficiency anemia over time. The symptoms of iron deficiency anemia can vary in severity, but often include fatigue, weakness, pale skin, and shortness of breath. These symptoms occur because the body's tissues are not receiving an adequate supply of oxygen due to the reduced hemoglobin levels in the blood. While iron deficiency anemia can have various causes, including dietary deficiencies and other gastrointestinal conditions, it is important to consider the possibility of colon cancer, especially in individuals with risk factors such as a family history of the disease or other concerning symptoms. Number 7. Feeling of incomplete evacuation. Feeling like you haven't fully emptied your bowels after going to the bathroom is a common concern. However, if this sensation occurs frequently and is accompanied by other symptoms, such as abdominal pain, bloating, or changes in bowel habits, it may indicate a potential blockage in the colon. A partial blockage can lead to difficulties in passing stool efficiently, resulting in the feeling of incomplete emptying. Ignoring persistent feelings of incomplete evacuation could potentially lead to complications such as constipation, fecal impaction, or more serious conditions like colorectal cancer. Therefore, it is always advisable not to ignore concerning symptoms related to bowel movements and seek timely medical advice for proper diagnosis and treatment. Number 8. Nausea or vomiting. Persistent nausea or vomiting, particularly when experienced alongside other gastrointestinal issues, should be taken seriously. These symptoms can stem from a variety of factors such as infections and digestive issues. However, they could also signal a more serious underlying health problem like colon cancer. It is crucial to pay attention to ongoing nausea or vomiting, as they may be indicative of an undiagnosed medical condition. Ignoring persistent gastrointestinal symptoms could delay necessary medical intervention and potentially worsen the condition. Therefore, it is advisable to seek timely medical advice when experiencing prolonged nausea or vomiting paired with other digestive problems. In some cases, these symptoms may be related to benign issues, like food poisoning or gastritis. However, given the possibility of more severe conditions like colon cancer, it is vital not to dismiss persistent nausea and vomiting without proper investigation. Number 9. Changes in bowel movements. If you observe that your stool is becoming thinner, similar to the shape of a pencil, or if you feel like there is something blocking during bowel movements, it may indicate a possible narrowing in the colon caused by a tumor. These symptoms are concerning and should not be ignored. It's essential to promptly discuss these changes with your doctor to rule out any serious underlying issues. Persistent thinning of stools or feelings of obstruction could be early warning signs of a colorectal problem that needs medical attention. A thorough evaluation and further diagnostic tests may be recommended by your healthcare provider to determine the cause of these symptoms. Number 10. Family history of colon cancer. Having a family history of colon cancer or polyps can raise your chances of developing the condition. If one of your immediate family members, such as a parent, sibling, or child, has had colon cancer, it may be necessary for you to begin screening at an earlier age. It is important to have an open discussion with your healthcare provider about your risk factors and potential screening options. Early detection can significantly improve treatment outcomes for colon cancer. Your healthcare provider may recommend genetic counseling to assess your individual risks based on your family history. Regular screenings are crucial in detecting any abnormalities in the colon and preventing the progression of the disease. It's essential to be proactive and informed when it comes to managing your risk factors for colon cancer. By staying informed and following recommended screening guidelines, you can take steps towards early detection and prevention of this potentially serious illness. Conclusion. It's important to remember that experiencing one or more of these symptoms doesn't necessarily mean you have colon cancer. Many other conditions can cause similar symptoms. However, if you experience any of these warning signs, it's crucial to discuss them with your healthcare provider promptly. Early detection and treatment significantly improve the chances of successful outcomes in colon cancer. Regular screening tests, such as colonoscopies, are also essential for detecting polyps and early-stage cancers before they cause symptoms. Don't ignore your body's signals. Take action and prioritize your health. Timely diagnosis allows for appropriate medical interventions, including surgery, chemotherapy, and radiation therapy, as needed to treat the cancer and prevent its spread.